Hello everyone, and welcome to this concluding webinar on Global Rural Health Summit. Here we are going to discuss one of the most important thing that is regarding our Bengaluru Declaration on Rural Health, and it needs all your opinion, your views, and we're very happy to take your views and consider it into our declaration. And then we'll have a discussion on the next topic that is regarding the global health issues and our perspective on rural health. Before we begin, I'll just allow you all to introduce yourself, and I'll begin myself. I am Dr. Pratyush Kumar, Chair of Wonka Rural South Asia and Chair-elect of Rural Wonka, which is Wonka Working Party of Rural Practice, and also the convener of this Global Rural Health Summit. Next, Christos, if you are free, you can just introduce yourself.
Yes. Thank you very much. Christos Leonis, Medical Faculty, University of Crete, and Wonka Working Party on Mental Health Chair. Thank you.
Thank you. Margarida.
Margarida, I'm from Portugal. I'm a family physician and also a teacher at the University Clinic of the Faculty of Medicine of the University of Lisbon. And I'm a member of the Wonka Working Party on Research. And I'm very interested in research and organization of care.
Thank you. Marjorie Cross.
I'm Marjorie Cross. I'm from Australia, from New South Wales. I'm very conscious that this is not a lower middle income country, so I've just been watching this with great interest.
Thank you. Thank you. Siarhan.
Okay, thank you. Good evening from Indonesia. I'm Sarhan. I'm a rural family physician and also chair of rural Indonesia organization. Thank you.
Thank you. Oleg.
Hello. I'm a rural GP in northern Norway and immediate past president of EUREPA, European Rural and Isolated Practitioners Association. Pleased to meet all of you.
Paula.
Hello, everyone. I'm Paola Torres-Limin. I'm from Peru. I'm a research professor. I'm an MD, and I work with rural and remote communities and indigenous people.
Thank you. Gobit.
Hi, hello, everyone. This is Gobit from Sri Lanka. I'm a rural family physician and academic, and I'm the part of the Rural Council. Thank you to be here.
Thank you. Thank you. Prem Adhish Lekhi. Can you hear us? Dr. Anshu.
Hello, everybody. I'm Dr. Anshu. I'm a pathologist from the Mahatma Gandhi Institute of Medical Sciences, Sevagram in India. And I'm here representing the board of directors of the Network Towards Unity for Health, TUFH. Thank you.
Thank you. Next is Ram Prasad.
Hello everyone, I am Dr. Ram Prasad from India. I am a family physician working at Community Health Center, joined recently.
Welcome. Shahina. Shahina.
Hi, I'm Dr. Shahina. I'm a DNB family medicine resident from Bangalore, India.
Welcome. Sanika.
Good evening, everybody. I am Dr. Sanita Vaidya. I am representing the Medical Students Association of India, which is a group of undergraduate medical students. And we might be the youngest in the room, but we would love to hear all the insights everybody has. Thank you so much.
Saurabh Mini.
Hi, I'm Saurabh Mini. I'm the co-founder of Sudama Health. We are building a chain of telemedicine clinics. We have our first clinic running in rural part of Bangalore, Chandapura.
Great, great. Dr. Subodh.
Hello, I'm Subodh. I'm from Mahatma Gandhi Institute of Medical Sciences, Sevagram, a medical teacher and working currently as professor and head community medicine.
Welcome. Yashashvi?
Hi everyone, I'm Yashasvi and I'm an MBBS student. I'm also from MSCI. Thank you.
Welcome. So first we'll begin with our Bengaluru Declaration. I'm sharing you the details of Bengaluru Declaration, and we'll take your views on this because I think we all have a look on. I've already shared it in the group, but you can have a look at here. And this Bengaluru Declaration on Rural Health takes into account lots of things regarding the primary health care, the research part, the education part, the resource part into it. And I'll just like to have, because we have received lots of suggestions from Dr. Anshu, I'll invite her to begin with her comments on this Bangalore Declaration, what we can do and improve on this thing.
Just made language changes and you can see if you agree or not agree. So that you can just read it out. I haven't changed the context too much.
Right. So I'll just begin with the Bangalore Declaration on Rural Health. This is a basic declaration that we are going to adopt on the 4th April 2025, and that is basically reaffirming our global commitment to addressing the evolving challenges and opportunities in rural health. Earlier, we had a similar kind of declaration in Limerick in 2022, which focused on the rural healthcare policies, and Delhi Declaration was we did take into consideration the Almata and the revisited the Almata Declaration during this Delhi Declaration part. Main aim is to have a strengthening part primary care, but we wanted to reaffirm the need to have prioritized recruitment and retention of family doctors as a cornerstone for rural primary care, along with the other health professionals who play important roles in the primary care team, including nurses, health workers, mid-level health workers, because it's all about a teamwork. And we have also addressed regarding the policy to have rural proofing of all the policies so that this policy meets the unique demand of our rural health rural population. Addressing health workforce shortages, this is a common challenge which we face regarding the persistent shortage of qualified healthcare professionals with broad range of qualified generalist skills required for rural practice. And so for that, how we can recruit them and also retain them. And for that, education is also important. That's also we have taken consideration in this draft. And we have seen lots of workplace associated violence against doctors, nurses, and that we have also made sure that that's covered in this declaration to ensure the safety and well-being of rural healthcare workers is equally important. And we have urged the government to enforce amend the laws and policies to protect health professionals from violence, harassments, and occupational hazards, and to build a resilient rural health workforce. We advocate for the promotion of family medicine and community-based immersive learning experience, equipping trainees with skills and a deep understanding of rural healthcare needs. And universities should recruit lots of rural students and be held accountable for having students exposed regularly to rural practice. They must recognize rural clinicians as important faculty members and role models for the future rural doctors, because we believe that unless and until we bring changes at the education level, at the undergraduate levels, there won't be much changes at the later stages. If the young doctors or young nurses are exposed to rural areas, like rural immersive training, then only they can be retained and recruited in the rural areas. And for that, we are creating a conducive environment and providing incentives. We can also give incentives so that they feel much secure. Regarding the career prospects, they feel much safe and secure working in rural areas. The incentives may include the financial benefits, housing support, and social amenities to ensure that family doctors, nurses, healthcare workers, and their families lead safe and have happy lives in communities, encompassing financial benefit, housing support, and social amenities. And we have also touched upon the digital health technologies. We know that digital health technologies have come up in a big way, but the in our context, like in the South Asian context, people still feel that seeing in person a doctor is much more easier. They may feel much more confident in taking the prescription and taking the advice after seeing face to face a doctor. They much believe in the treatment which is being provided by doctor than to an online consultation. So the digital health technology is definitely one of the option, but it's still very challenging in rural areas. One is network connectivity is there. So we need to address the digital divide, and we need to ensure that there is equitable access to technology and improving digital literacy among rural populations. So well, not only technology is important, but also digital literacy is also equally important to leverage digital health areas. Enhancing infrastructure and access, addressing social determinants of health such as poverty, sanitation, and nutrition is crucial and essential to achieve for improving better overall health outcomes. Investment in healthcare facilities, transportation, sanitation, and communication networks is critical. And for regarding promoting community engagement and empowerment to make the treatment acceptable to community, we need to engage them well at the grassroots levels. So active community participation in health planning and decision making ensures that healthcare services are responsive to local needs. Rural proofing of policies must listen in the solutions raised by rural communities and foster them implementing local solutions to local problems. So here we have focused on having local solutions for local problems and engaging them in the planning stage itself so that they can be very much part of the solution for which the problems which they are facing, and they understand the solution is whatever the solution being proposed is acceptable to them, it's culturally appropriate to them. And addressing emerging challenges, rural communities, they are increasing vulnerable to consequences of climate change, including extreme weather events, food insecurity, spread of infectious diseases. So we need to also have a surveillance and response system for infectious diseases, along with addressing growing burden of NCDs and mental health conditions, and that needs to be prioritized. And regarding data and research, that's very much important considering our South Asian context and also LMIC context. The 90-10 gap is very much evident. And one of the things which we did through the summit is to publish paper. We we really wanted to document whatever things we are doing, and that's how I believe that that's the area where we lack in documenting the things in publishing papers. So we need to do much more publishing, much more work in publishing research, and this is one of the attempt to go forward in these areas. So data and research is something very important, and we believe that promoting research on rural health issues will support evidence-based solutions and the unique challenges faced by rural populations. So research must meaningfully include those communities and address their problems and report back them to them. That is the very best saying that nothing about us without us. So you need to involve them in all the research kind of things. And this is finally the call to action. We urge government, international organizations, healthcare providers, civil societies, and the private sector to collaborate uh, in implementing these commitments. Global community must prioritize rural health in national and international development agendas. And we must also have some specific accountable actions regarding adequate facilities, adequate fundings, university placement in rural, and postgraduate training in rural and remote medicines. So this is a brief summary of the Bengaluru Declaration. I'll just take your opinion on this Bengaluru Declaration. And obviously, I've shared the link, but I'll again copy it and I'll put it on the chat box here also. So I'll take the opinion from you all, and here in the comment box, I have share it. Yeah. So we'll take views one by one, and I will begin with Dr. Subodh. Would like to talk regarding this Bangalore Declaration?
Yeah, I feel that it's well designed and lots of important issues have been brought up. I'll contribute as the discussion moves ahead, not having any specific point at present.
Thank you. Gobit, anything to add?
Yeah, actually, that it was comprehensive, even though there's a briefly everything has compared here. I think it's a good document, even though like we did in the previous years like that. So anyway, the good place to they are in India, Bangalore. So we'll go ahead. So anyway, I'll go through the document as well, the final one. Okay, thank you.
Okay. Thank you. Marjorie, you have some comments. Can you please speak?
I also think it's a good document and that you've covered the issue of nothing with that it must come from a community base. But I'm always wary of making sure that women doctors are included in our country. For example, we have more women doctors now than male doctors, and there's a life cycle issue for us in terms of rural placements. However, this is not about our country, it's about all those other jurisdictions. I just want to make sure that women's health is something that's highlighted along the way.
Okay, sure. We'll include regarding this. We'll try to include that also in this paper. Thank you. Margarita?
Yes, so I just wanted to say, like everyone else, that this is a really important document. I think that some aspects are really specific of of some sort of regions where rural healthcare or the rural healthcare system doesn't have an answer or an immediate answer. So I don't know if this should be taken into account or if this document should be specific for this shortage in some areas, such as the Southeast Asia area. Or
the rural healthcare issues, like a shortage of doctors, is like a global issue. I think.
No, yes, I really think that it is a global issue, but since, as we reported in our papers, some countries are managing this in different ways, and this problem is being tackled in different ways in many countries. So I think that this document is really interesting and important. But I think it highlights only the worst perspective of this rural health shortage, and I think it's okay if we wanted to keep it this way. But I don't know. It was something that came to my mind while I was listening to your report, and I wanted to hear your thoughts on if we should give this scenario, this worst case scenario, because it's what really frightens all of us with this continued or increasing shortage of GPs, which will only worsen this everywhere. So this is kind of a very difficult issue.
Okay. I think the whole idea of this declaration is to attract the attention of policymakers, the government and non-government organizations toward the challenges being faced by the rural population. And also with other papers, we also are publishing some papers. And through that, we also showcase positive models also, that what has worked really in the rural areas. But this declaration is specific that we are going to clearly mention those challenges which are being faced by obviously the LMIC context is obviously there, but we also want to cover global issues in this paper, in this declaration. Christos, do you want to comment on this?
Yes, yes. Thank you very much. I think, unfortunately, I have not seen the Google Doc, and I suppose that I will do, given my responses this evening. In generally, that's as I listening, it's a good paper, but I'm strongly suggesting utilizing as potentially as a guide, or at the last part, by providing a specific recommendation for the instruments to be used. I think that's a standard declaration. A standard declaration, especially the second and the third volume, just focusing on the vision of a primary care, gives to us specific instruments. I think that's 11 or 13 instruments, including the research, and how to transform primary care. And I think I'm planning it just giving and adding it to the text because it's very, very important. I'll be making this clear link with the WHO and especially a standard declaration. If we just provide in such direction a recommendation to transform the current healthcare systems towards a favorable environment for rural health, I think that's making also this declaration more practical and giving also suggestions and recommendations to the rural leaders. I think that is my key points, but I'm planning in adding some specific comments and suggestions this evening. Thank you very much. Thank you.
Thank you. Thank you. I think that's a very good suggestion to include like a paragraph regarding the recommendations also. Dr. Ejaz Khan?
Yeah, I just wrote down my little bit of recommendation. Quite a good document. And I think this Almata Declaration, after Almata Declaration, several countries have started with the primary healthcare management course and with the focus of primary healthcare, and the physicians were also trained for primary healthcare. Primary healthcare was implemented in several Southeast Asian countries and South Asian countries as well. So, referring to those declarations is a very, I think it's a good step when we write a declaration. I have just one suggestion. If we could add something about research, implementation research, and generation of local evidence by the primary health physicians, because it is greatly felt that primary health care physicians, they don't have this incentive of research and publications and their personal and scientific growth, and also they by research and being involved in the implementation research, they keep abreast of the latest technologies, latest guidelines, and that's something that we lack in South Asian context. And our primary healthcare physicians, they are left behind, far behind than their colleagues working in the tertiary care hospitals in the big cities. Thank you.
Thank you. I think we had tried to include that thing in the data part, but we need to modify the wordings to be more clear regarding the research and incentives part in that, and that we can just we can try to do some wordsmithing in this paper.
Yeah.
Thank you.
Yes.
Thank you for your comments. Thank you. And we'll take some view of our medical students. I'll go with Sanika. Sanika, can you hear us?
Hello. Yes, I
Yeah.
can. Yes, I was just also again reading through the points. There was one point where we spoke about including students, rural students, and placing them as trainees. Maybe we can also include students for health promotion per se, and advocating in the community level along with we can include them in healthcare delivery definitely, but to combat this shortage of workforce, maybe we can have students take care of the advocacy part and uh, like uh, like impart the knowledge that is necessary for on a community level, basic awareness about health issues.
Okay. Regarding students, there is strong evidence that if the students are being trained in rural areas, like if we have medical schools, medical colleges in rural areas, and they are trained in rural areas, like this immersive training in rural areas, then they are more likely to be retained and recruited. They love to be recruited and retained in rural areas. And
Yeah.
but I'll take your
Instead,
point regarding including them in the healthcare delivery. That's a very valid point.
yeah.
Okay.
There is one more thing that is currently happening in India. Is
Mhm.
we have a system in our PSM called as Family Adoption Program. We
Right,
have
right.
a community medicine HOD here, so they would be able to share better light on this. Uh, so it is basically students from first year till their third year. They take care of one family in their adopted village for every college. Through
Right,
that, maybe we can also like we can combine these two initiatives together.
right, right. Uh, I think the Vardha has got very good model for that. I'd like to bring again Dr. Subodh to talk regarding the family adoption model from the Vardha and how it's working and what's happened the response from medical students and the impact it has created.
Yeah, thank you so much for talking about this program. So, what has been mandated at national level, it is in a way the model which was not exactly what has been developed, but inspired by the Vardha model of village adoption program. We call it village adoption program. And yes, this is a good opportunity. Although at this moment of time, medical institutions at many places, they are also struggling in uh, actually implementing family adoption program. There are several challenges, but in the long run, it is an important uh, curricular change, you can say, or approach that will be very, very important. Uh, I think exactly, I will not tell a lot about this model. This may not be, but definitely it should be mentioned. It may be, and already you have probably included it in the term of community immersion program. So that is very important, and it already finds space. Somehow, if one or two sentences we are able to link it. Uh, or maybe we can add, that would be helpful. But one important thing which comes to my mind is uh, this has been advocated for doctors. I also feel, and Pratyush, in your sentence, it came, it would be written probably in the document also. We need to think about other health professionals also. In different ways it is given in the curriculum or by the respective councils. But if it can be thought over or if it can be advocated for uh, other health professionals, that would be wonderful. And if a kind of interprofessional a model, wherever possible, it won't be possible at every place, but there are institutions where nursing, medical, or dental colleges are functioning together as other courses, health professional courses. So if that kind of model is also tested, that would be very helpful. And if students of different health personal courses are met to learn together, they in long run will also learn to work together. So I'm quoting from a sentence of Dr. Abraham Joseph. He was earlier director of Dean and Director of Christian Medical College, Vellore, and I heard him telling this. So we may advocate it more strongly, and this is really something important, I feel.
Okay. Oleg, I like to bring you here for to understand the European context of it, how the things work in Europe, in your country.
Yeah, what is happening in Europe, I guess, is happening in all of the world, because it's recruitment and retention. It's the biggest problem, and generation change, of course. And I guess to ensure a continuity of primary care in rural locations, especially, it's important to engage several actors in this field. Like, we need input from academia, absolutely. And it's not only about training of young GPs, but also of CME, of GPs working in especially in isolated areas. They should not feel themselves isolated. Another point is policymakers, because I guess it's not a big secret that recent, perhaps 10, 15 years, GPs were overwhelmed by manual tasks, not having anything special with treatment, but mostly with bureaucracy. There's a lot of reports, I guess in every country it's about the same. And this makes our profession not so attractive to young GPs, because they prefer to go to some other place. And now in Nordic countries especially, we have a crisis of, it's almost impossible to sell your practice. And retired GPs in my area, in my community, one guy was trying to sell his practice for 3 years, and then he didn't succeed, and he needed just to give it to community for some not sustainable amount of money, but he needed to just to go forward and continue his life. And I guess we also need to remember that young GPs and young doctors generally have a tendency to divide their private life and their professional life. And they need to be with their families, and they appreciate to be good mothers and fathers. And of course, it's important to remember. I also would like to stress the point raised by a previous speaker, that it's important, and I believe it's paramount, to engage the whole team, because no man is an island, especially not GP is an island, and rural GP double so. That's why we need a good team around, and we need to cooperate with other professions in medicine, including nurses, physiotherapists, dentists, and so on. Plus, we need to rely on the community support. That means that we need to engage with schools and other people in the community, because it will expose them very early to medical practice, and perhaps will help them to define their career. And coming back to this so-called salmon or barramundi effect, when people who grew up in rural locations will come back to rural locations after finishing graduating medical universities. So in this case, community could be supportive. What we did in northern parts of Scandinavia, that some communities gave the financial support to students, especially during the last years. And then in return, these students, when they became young GPs, they came back to the community and worked there for a certain period of time, at least. So it can give some kind of a temporary solution, but speaking about the future, and I still believe in a bright future for general practice in rural locations, because it's a fantastic place to work in. We need to ensure very good support from politicians, from administration, and from academia. And it's win-win situation for both, because research is also important, which makes our profession attractive. We have huge areas of and huge amounts of data but sometimes people just don't have time to invest their remaining time into research. So I guess I like this declaration, and I believe after some
Thank you.
work, it could be even better. Thank you.
Yeah, thank you. Thank you. And you can just comment on the declaration part, and we'll be very happy to include those the suggestions into the final declaration. Okay. Dr. Subodh, please go ahead.
Yeah, I have 2 points to share. One is related to like provision of training for family physicians, especially thinking about India. There are very few medical schools which are offering post-graduation in family medicine. And how it can be, and I do understand it would be a situation in several other LMICs. So how it could be strengthened on that perspective is important. And it's not only about family physician, but it is also about mapping what are the health professionals required. I feel that, say, a specialist in lab medicine, someone who can do pathology, microbiology, biochemistry, all lab tests, that kind of specialization would be important when it comes to rural practice, instead of isolated pathology, microbiology, and biochemists. Of course, we require them for urban areas, but when it comes to rural remote areas where communities can afford only one lab personnel, a specialist. So we need to map out and make provision that way. So how we can emphasize on this aspect should be one important thing. A second aspect, and unrelated to this, is we need to think about the demographic transition which is happening, and it's already happening, and even in LMIC, within 2 or 3 decades, we are going to see a large proportion of elderly, and how we could be prepared for that. So I'm not sure if it already it has been mentioned somewhere in the document, but emphasizing it would be important. So how care of elderly could be streamlined, we could be more prepared for that. Yeah, in different ways. And again, through the diversity of healthcare professionals, which could be available.
Okay, sure. We'll take opinion with Dr. Dako. Can you hear us?
Yeah. Hello?
Yeah, please go ahead. You need to unmute
Are you hearing
yourself.
me?
Yes.
I'm sorry, I came in late. Actually, about 5 minutes to the beginning, I had an emergency. I had a woman with a cord collapse. I had to rush into the theater to do a cesarean session. So I just got in about 5 minutes past 5. But I think what we are discussing is the challenges that we are facing right now as rural practitioners. Am I right?
Right. We're discussing the Yes, please go ahead.
And from the African point of view, especially Nigeria point of view, the problem we are having right now is that a lot of personnel, head personnel, are moving away from the country. We have a lot of pushing factors that are pushing them away. We don't have any pulling factor bringing them in. The 2 major problems we have: 1, security, and 2, the economy. The insecurity in rural communities in particular, where primary health care actually has much impact, is very serious. We have a lot of people, personnel being kidnapped, some killed in the process. some families have to borrow money to pay ransom. So as a result of that, most of our rural facilities in the rural community are deserted. Nurses, doctors, pharmacists, physiotherapists, lab scientists, they are running away. It's a very, very, very serious problem. The countries of destination are the USA, UK, the Gulf countries, and Australia. And the other one is the economy. The currency just got devalued. And as a result of that, earnings can no longer sustain families. And those that have migrated, I mean, when they tell their stories to those people that are around, the people that are around get attracted. So we are facing serious challenges. For people like us that do free healthcare in rural communities, it's a very serious thing for us. For the past 1.5 years, we've not been able to carry out any mission. We have the resources to do it, we have the personnel to do it, but insecurity is a major problem. These are major problems, and it's very, very, very serious. It's very, very, very serious. And the government probably, I mean, we don't think they are providing the enabling environment for us to work. So these are our challenges. Thank you.
Thank you. I think migration is big issue in most of the low and middle income countries because there is healthcare workforce shortages and people are going away for like better salary, better incentives. And these rich countries do provide a better environment and they feel much more secure of their job. That's why they migrate. And during our last webinar, we have discussed that in detail regarding the health workforce dynamics from education to training to recruitment. They are being trained like when the doctors, nurses, or any professionals are being trained in government's hospitals, they are being trained with lots of cost by the government, with expectations that they will serve back the country where they're being trained. And when they migrate, actually, it's a big loss for any country which are being investing a lot amount of money for their training, their basic training, and that's a big issue for lots of countries, I believe. I'll go to Bangladesh. Jakir Rahman, can you hear us? Jakir?
Yeah,
Yeah. Tell us the situation, what's happening
it
in
is.
Bangladesh, how you all are dealing with it.
Uh, yeah, I'm sorry for late because here Ramadan, I came from. So yeah, so many challenges we have, but declaration is very good. So thanks everyone, those who contribute, and some input maybe better the declaration finally. So research, training, and incentive is very important. Some issues are all in global, but some issues is more related with South Asia. So for workforce and training, not only young doctor or rural doctor, we need to teamwork to include all sorts of health care in the line of rural health services, and as well as diagnostic tool. It's very important issues to serve in rural areas. But so many challenges. But nowadays it's time to minimize the gap between rural and urban services. In Bangladesh, 2 year service in rural area is mandatory to posting in teaching hospital or even tertiary hospital. So it's an improvement. And 15 days, at least 15 days mandatory training in undergrad. It's for all government and private candidate. So issues are coming up, and hope it will work better. Thank you all.
Okay.
Pratyush.
Again, we'll come back to medical students. Anyone would like to start off, Mini or Yashashvi K? Anyone would like to comment on this? Yeah, go ahead.
I had two more points about it. One, we can add something about health literacy of the patients, because if the patient is able to understand what health information and instructions are given to them by the health professionals, it might have a better outcome, because mostly they are reluctant to approach the health professionals because they fear they might get frustrated with the communication with the health professionals. So I think we can add one small point about it. One more is about the social stigmas may because uh, out of all the health areas, few of them like mental health, sexual health, and sometimes about mostly about seeking counseling and treatment for HIV and sexual health. So those things need more emphasis because of the social stigma, they are reluctant to go to the health professionals about it. And the last point was just like Dr. Subodh sir mentioned, care of the elderly patient. So in rural areas, there are many elderly people who have chronic conditions and they need regular follow-up. So if in rural areas, if they don't have proper transport to the healthcare facilities, so that can be a big problem. So I think we can add one point about it.
I think you raised a really important point. I think this is part of most of the government guidelines that the healthcare infrastructure should be geriatrics friendly. They must have friendly to all those who are disabled and all those who are in that age group, so that they can really access the healthcare services. And yes, we have included the social determinants of health, including education is there in this declaration. But yes, the health education part, it would be good if we be much more explicit, much more clear on this point.
Like it can be
Points well taken.
taken care by the NGOs and the student organizations who are more active in these areas. So it will be easier
Good.
for them to like implement these things, awareness, education programs, and all. Thank you.
Thank you. Thank you. Thank you. Saurabh Mini would like to talk?
Yeah, hi. Just one thing. Hello, can you hear me?
Yeah, please go ahead.
Hello.
Yeah, we can hear you.
Yeah, I just want to mention a couple of things. One is there are a lot of unqualified doctors who are set up shops in the remote areas, especially, and they are not they are probably homeopaths or Ayurvedic doctors, but they prescribe uh, other medicines as well. And injections is another thing which is there. Like people want those injections instead of taking medicines. I don't know how we could address it. I've just been observing these things in the last few months that we have been running this clinic. I'm not sure how we could add this. And more importantly, one more point that Oleg also touched upon is if the professionals come from the community itself, and that's much better for the community. So some kind of incentives for being from the community, like to get people from the community become those professionals. That should be something probably we could add in some way.
Hello.
Hello.
Yeah.
I'm not sure if I made sense there.
Look, you've raised a very important issue regarding this, and I guess there have been lots of concern regarding this mixopathy and the bridge courses to include the homeopathy and Ayurveda, and to teach them regarding the modern medicine, which is modern pharmacology, and so that they can prescribe medicines. They also have, but I guess these issues are definitely important, but uh, in the country with huge population, we do need lots of people. That's why government has also focusing on mid-level health workers and training nurses, nursing practice nurse. There are lots of things. I guess it's more to do with the health workforce and the government policies, but I believe that the patient is the ultimate judge. Once they are much more educated, they know regarding the priorities, they know regarding the uh, importance of healthcare and where they should seek healthcare, then much will change. Else it's all on us that we should be bridging those gaps. If the gaps will be there, then people from different groups will do take over the things. I think it's a very complex issue, but and it's mostly dependent upon the government policies. But yes, the government, the medical association, the IMA is raising lots of concerns regarding this, and let's see what happens. But certainly believe that if we have got adequate number of doctors, to qualified doctors in rural areas, and specifically if their communication is if they are able to communicate well with the patients, and if they build a rapport with communities, then people will definitely go to qualified healthcare professionals. Okay, so let's talk regarding some other issues regarding data and research gaps regarding publications. Um, Christos, do you have anything to talk about publications?
Yes, first of all, thank you very much. I very much appreciate a very enjoyable discussion. I think that research already is a key issue. We have published a couple of years ago an editorial in Family Practice where making recommendation, especially to the editors, and how to meet rural research, because that's to our view still there is a discrimination of the papers they deriving from rural areas. I'm planning hearing this paper, and I fully agree that having more rural focused medical schools utilizing the paradigm of some settings, and I'm planning just raising a couple of recommendations how to invest in rural related to research. There are some evidence, especially published in International Journal of Remote and Rural Health, the journal of previous supported by Ivonka. But if you allowed me, as one of closing statements, I think in that Dr. Kumar and colleagues, we needed not only just, of course, coming across many statements that have been already discussed many times. I think in that we needed in supporting another voice at the moment. We needed a world that's making social planning in a different way. I'm thinking one of the fantastic papers of one of the very wise people, one of the leaders years ago in Frontiers, a journal of psychology, that exactly saying we needed a more compassionate world. And that's the title of this paper I'm planning a hearing with all of you. Is a focus is necessary in given to sharing and caring instead of controlling and holding. I think that is a very clear statement. We needed a more compassionate world. The concept of compassion is going to be disappeared at the moment. That and also we needed a different world to making a different social planning, giving priority to human lives. I think that is most important. But also, I'm strongly supporting all of the wonderful statements expressed by all colleagues, and then also I'm planning a little bit giving utilizing our paradigm for isolated and rural Crete. We just having the chance, despite the many barriers, to improve research. But that's you provide me the chance in saying that we needed leaders, and you are the leaders. And I remember many times that also I had mentors, and one of my mentors that who inspired me many years ago when young physicians were John
Win Jones, one of the previous Vonca working party in rural health. That please stay and keeping your role as a leaders and in inspiring the young people. I'm certain that the rural health could identify its boulevard. Thank you very much, Dr. Kumar. Thank you.
Thank you. Thank you. I think we have come to the closing of this of our final webinar, and we'll take your final comments. And we have like made this summit a hybrid, so you can now connect from anywhere in the world, wherever you are. You can just be a part of the summit, and all the authors of the sub papers. I would like to request you to please join us online so that we can have a very active discussion during the summit part. And before we end, we'd like to have final comments from you all. If you'd like to make any final comments, Margarita?
Yes, I would actually like to comment on this research part. Because I think it's really important to have data on rural patients and populations and communities, but also on the provision of care for rural patients. And I think one of the main strategies would be to increase the number of rural PBRNs so that we can have evidence that is created directly to these patients and these communities that are being served. And also, I think about this when I'm thinking about this statement, this declaration. It would be good also to have some sort of way to monitor what's being recommended. So it would be nice to also recommend research on the implementation of the strategies that are proposed in this declaration. I also made my comments also in the declaration.
Thank you. Thank you. Mahmoud, Dr. Yeah, your final comments, please.
Just like I said, I got in late and I'm very sorry for that. I think there's a need for us to have a global policy on this migration of healthcare workers. It will help the low and middle income countries because you see, the movement is always to the developed countries. And I think we have a concerted effort to actually have a policy. The low and income countries will benefit. Thank you very much.
Thank you. Thank you. Oleg?
Yeah. Yeah, it looks like we need to perhaps concentrate our efforts internationally, global level, on persuading the authorities to understand the value of rural medicine, because for example, during the COVID pandemic, those countries with pretty well developed primary care did much better than countries investing in secondary and tertiary care. So this is just one example. And I believe well-being of the country depends on GPs and primary care, especially in rural areas, because in some countries, these people living there are deprived of any decent care, as all we know. Thank you.
Thank you. Dr. Subodh? Your final comments?
I think it's coming up well, and we have already discussed several points. Let us make an effort to include this. Yeah, nothing else to add.
Thank you. Thank you. Gobit Ratnam?
Yeah, actually, we have discussed, but in there, I just wanted to give in the wording like from the strengthening primary care, we can mention about this health allocation. Actually, we are already mentioned, and the health workforce. Actually, we have to we can put some other small wording on the rural expose on the strengths. Already, we have put in a different way, and the committee engagement and all, actually we have put, but anyway, we can put some more about the health education, because the health literacy and all maybe very we are seem to have less in the rural area. So the health education we can put some more weight on that. And the challenges actually I just texted there. So like NCD, infectious diseases, also the global trend, but still age population and palliative care services are which are limited. So that if we possible, we can put a note of making the more wording, but we can add on that. That's all from me. Thank you.
Thank you. Thank you. I think aging issue, geriatrics health, and also the palliative care and sexual health should be there in the document. We'll try to include that thing also in the paper. Okay.
Yeah,
Marjorie,
thank you.
do you have any suggestions? Sanika Vaidya?
Oh, hello, sir. Sorry. I was saying, like it was earlier said about the awareness and health literacy. We should include a point on that, as well as what we had discussed at the start of this meeting was about the women healthcare workers and their posting in the rural area. So we should maybe consider that as well, like a point or so, considering
Okay.
that.
Okay.
Yeah,
And
that is.
please, yeah, please feel free to like do a comment and suggest on the
Yes, yes,
document.
sir, definitely. Yes, sir.
And we'd be very happy to accept those suggestions. Thank you.
Yes, sir.
And we'll take anyone else would like, Dr. Anshu, would like to comment?
Yeah, I think the declaration is coming up well, and today's discussion added a few good points. I would like the call for action to be a little stronger, like Christos said, and maybe the recommendation and the call for action, we could word it a little differently and make it a little more strong. Thank you.
Yeah, we need to add some recommendations in the call to action point. Dr. Christos, would you like to add some call to action points and recommendations into the final concluding remark?
No, thank you very much. I'm very happy that's listening all of you. Thank you very much. Very inspiring discussion. Thank you.
Thank you. Thank you. Paola?
Yes. And just to make a point is that in the call for actions, be very precise. I left my comments there, but be very precise for universities, for medical education, as why it is important, because we are already questioned as global health leaders, as rural health physicians, is it effective or not? No. So come out, yes, it is important, and we can escalate this importance and the prestige for the future rural health doctors. That's my point. Thanks.
Thank you. Keshwan, can you hear us? Keshwan? Okay. So I think we have taken most of your views and will consider these things into our final declaration. I'd request you to just add your comments into the declaration part so it becomes much more easier to just go through it and ensure that all the points are well taken to the declaration part. And obviously the summit is now hybrid mode, so you all can join us for the summit, and it's great to have you all there during this Global Rural Health Summit on 4th April. We look forward to seeing you there during the summit, and we will be publishing papers. There are 6 papers based on the sub-themes, and there is one additional paper on the global this Declaration of Rural Health. So totally we'll be coming out with 7 papers out of the summit, and with over 60 authors for these 7 papers. I think we have done like all the authors have done a very good job in putting the words together for these impressive document which they have produced. So I'm very thankful to all of the authors who have worked very hard, and in this collaborative atmosphere, they have created a wonderful document. So thank you, everyone, and thank you the medical students who have joined us for this meeting. We'll be very happy to see you all together. Looking forward to the Global Rural Health Summit in next week. And thank you, Wonka Secretariat, for all the help in arranging this meeting. And we look forward to seeing you down at the Bangalore. Thank you.
Thank you very much, Pratyush.
Bye-bye.
Bye-bye.
Thank you, Pratyush.
Bye-bye.
Bye, thank you.
Bye.
Bye-bye.
Mm.